And on health, experts, policymakers and gender advocates have called for the prioritization of mental health as an integral part of adolescent, maternal and gender-based violence response strategies in Nigeria. They made a call at the Conversation Conference 4.0 held in Abuja. Captain News correspondent has more on this story.
Mental health remains a foundational component of overall well-being, but continues to receive inadequate attention in health planning and service delivery. Stakeholders said there is need for collaboration between governments and private sectors to improve access to mental health care, particularly for women, children, and survivors of GBV. Speaking at an event titled The Conversation Conference with the theme Mental Health as a cross-cutting priority for adolescent health, maternal well-being, and response to GBV, the Chairman Senate Committee on Health, Dr. Ekpalibo Baligu, urged for the inclusion of mental health services in primary health care and the National Response Framework to GBV.
We need to promote legal reforms that prioritize support for attempted suicide and rehabilitation and provide a legislative roadmap for decriminalization. We need to practicalize the integration of basic mental health services into primary health care services. Again, we know that one of the components of primary health care is mental health.
For the Ministry of Health, there is need for alignment of mental health initiatives with national priorities.
The Federal Ministry of Health and Social Welfare is in the process of reviewing the National Policy on Sexual and Reproductive Health, and for the first time, mental health is in that document. If we are talking about maternal mental well-being, gender-based violence, that is taken care of in that document. And also, presently, there is a pilot for the integration of mental health into antenatal care.
Also speaking, Amuna Lawan Ali, chairperson of the Intersect Consortium, highlighted the need for awareness, early intervention, and destigmatization, saying that mental health challenges often go unreported due to cultural and social barriers.
Mental well-being and the fight against gender-based violence cannot succeed in isolation. They must converge in our policies, our systems, and our collective consciousness. Let us connect, challenge assumptions, and reimagine what inclusive, compassionate, and sustainable mental health can look like for our people here in Nigeria and beyond.
In his opening remarks, Dr. Vincent Udense, CEO of the Intersect Consortium, stressed the need for collaboration between governments and private sectors to improve access to mental health care.
As individual organizations, can we continue to just speak as an organization, or should we unite our voices and drive a change in the sphere of mental health? I feel justice will not be served if you do not even take care of the mental health of these traumatized persons.
Other stakeholders also emphasized that mental health should no longer be treated as an afterthought in Nigeria's public health agenda, but as a cross-cutting issue affecting productivity, family stability, and national development.
Lawmakers and policy drivers must consciously take the bulls by the horns and make sure that a lot is done in this sector. We need to, promulgate more laws, and then the enforcers of these laws need to wake up and make sure these laws are more prominent and are more dynamic.
For the country, this is the best time to institutionalize mental health as a cross-cutting priority, one that safeguards the well-being of adolescents, women, and families to strengthen the nation's overall resilience.